my name is Morgan, and I'm going to be doing your head-to-toe assessment today. I would assure privacy if I could, and I'm going to put on hand sanitizer. Can I get your name and date of birth?
Tracy Pippin, 1371.
And do you know what year it is?
2020.
And do you know where you are?
In my kitchen.
Good. And the patient is a well-developed female. She looks her stated age. She has good, smooth, clear speech, and she's alert and oriented ×3. Now I would move on to vital signs. I do not have all the equipment to do vital signs, but do you know your height?
About 5'6" and a half.
And do you know your weight?
150 pounds.
Good. And so her BMI is within normal range. On a scale from 0 to 10, do you have any pain today?
No, 0.
Good. Okay, so now I'm going to move on to skin. Her skin is warm. The hair distribution is good. There's a few freckles, but other than that, there's no abnormalities. Color is appropriate to ethnicity. And I will check other parts of the skin as the assessment goes on. To do capillary refill, it's less than 3 seconds, so that is good. Now I will move on to her head. I'm going to check the hair and scalp in 3 different places. And there's normal cephalic. Her hair distribution is good, and I did not see any lesions or lice, so that was good. Now I am going to look at your face. Your face is symmetrical. There's a few moles, but no abnormalities. The color of your skin is appropriate to ethnicity. Now for your eyes. Your eyes, eyelids, and eyebrows are all symmetrical. Your eyebrows and eyelids are evenly distributed. And now I'm going to check your pupils. And pupils are equal, round, and reactive to light. I'm going to have you follow my pen, and I want you to tell me if you see double.
No.
Good. And her eyes accommodate well. Now I'm going to have you follow my pen without moving your head. All right, and eyes track well, and muscles are good. Now I am going to go on to ears. Her ears are symmetrical, and they line up well with the eyes. I'm going to touch her external ear, and I want you to tell me if you feel any pain or tenderness.
No.
About there?
No.
All right, and now I'm going to do the other side. Any pain?
Mm-mm.
Good. All right, now we're going to do a whisper test. So I'm going to stand behind you. I'm going to have you plug one of your ears. I'm going to whisper 3 words, and I want you to repeat them to me, and then we'll do the same on the other side.
Okay.
So I'll have you start with plugging your right ear, and just repeat the words after me.
Red.
Car.
Book.
Good. Now we're going to do the other side.
Blue. Sun. Dog.
Good. So the patient's hearing is good. Now we're gonna go to your nose. The nose is symmetrical, and I don't see any abnormalities. Now I'm gonna look in your nostrils. I don't see any lesions or sensitive areas. The septum is intact, and I don't see any holes in it. Now we're gonna do a patency test. So I'm going to have you plug one nostril and breathe in. And now we're going to do the other one. And there's good patency. Now I'm going to check your sinuses. Tell me if you feel any tenderness. Good. Now we're going to move on to your mouth. I'm going to have you open your mouth, stick out your tongue, and say ah. And the uvula moves well with phonation. I'm going to have you smile. And your teeth are white and clean. And I'm going to have you open your mouth again so I can look at the mucous membranes. and mucous membranes on both sides are pink without any lesions. Do you have your tonsils?
No, had them taken out.
Okay, so I would check tonsils, but she does not have them. Now I'm going to move on to the neck and lymph nodes in the neck. I'm going to start off with the lymph nodes. Preauricular, postauricular, occipital, submental, submandibular, tonsillar, anterior cervical chain, deep cervical chain, and posterior cervical chain, and supraclavicular. And was there any pain or tenderness?
Mm-mm.
Good. And I did not feel any of the lymph nodes. I forgot to do this with mouth, so I'm going to check for TMJ. I'm going to have you open your mouth. And there is a click on the right side. I'm going to have you move your jaw, lower jaw, back and forth. There's a click during that too. And then to bring your teeth back together. Good. So the patient does have TMJ on the right side. So I'm going to continue with the neck. The color is normal. It looks symmetrical. I don't see any abnormalities. There's a couple moles, but nothing to be concerned about. I did the lymph nodes, and I think I'm all set with the neck. So we're going to go to the posterior chest. So I'm going to have you swing your legs this way, and I'm going to stand on this side of you. All right. So the skin on the back of the neck is normal. I don't see any abnormalities. The shoulders are even, so are the scapula, and the spine appears straight. Now I'm going to test for symmetrical expansion. So I'm going to have you take a deep breath in and out. And there was symmetrical expansion. Now I'm going to do a kidney test. I want you to tell me if you feel any tenderness or pain. Good. All right. Now I'm going to do a vibration test. I'm going to put my palm on your back, and every time you feel it, I would like you to say the number 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And I felt vibrations through all quadrants. Now I'm going to listen to your lung fields. Every time you feel my stethoscope, I'm going to have you take a deep breath in and out. If you need to take a break, just let me know. All right, and the lungs sounded clear. I didn't hear any crackles or wheezing. Now I'm going to have you face toward me, and we're going to do the anterior chest. So I'm going to do the vibration test again. I'm going to put my palm against your chest, and I want you to say 99 when you feel it.
99, 99, 99, 99, 99, 99.
Good. And now I'm going to listen to the lung fields. So every time you feel my stethoscope, take a deep breath in and out.
That didn't sound good.
I did not hear any wheezing or crackles there either. All right, so now I'm going to have you lay down. And I'm going to go to this side here. So first I'm going to test for jugular vein or neck vein distension. I'm going to have you look that way. And I see a small pulsation in the jugular notch. Now I'm going to feel for the carotid pulse. And that is a 2+. And I'm going to do the other side as well. So I'm going to have you face that way. And that is a 2+ as well. Something I forgot earlier was the temporal pulse, so I'll do that right now as well. And that is a 2+ as well, and even on both sides. Now I'm going to listen for bruit in your neck. So I am going to have you take a deep breath in, let it out, and then hold your breath, and I will listen for the bruit with the bell of my stethoscope. All right, and I didn't hear any bruit on that side, so I'll check the other side as well. Deep breath in and out again. And I don't hear any bruit on that side either. So now I'm going to listen to the patient's heart, and I will listen with both the bell and the diaphragm of my stethoscope. So it's gonna take a little bit. Don't think that I can hear anything that's abnormal. Aortic, pulmonic, Erb's point, and I hear S1 and S2. Tricuspid, and the mitral. Now I'm going to listen with the bell. Aortic, pulmonic, Erb's point, and I heard S1 and S2. Tricuspid, and the mitral. Now I'm going to go to the patient's abdomen. I'm going to have you pull up your shirt a little bit for me. All right, so the patient's abdomen looks even without any abnormalities. There's a couple moles, but nothing to be concerned about. I do not see a pulsation in the abdomen, which is normal. Seeing one would also be normal. The abdomen's contour is flat. So now I'm going to auscultate the abdomen for bowel sounds. This will also take a couple minutes, so don't think that I can hear anything abnormal. All right, and I heard bowel sounds in all quadrants. Now I'm going to listen for the aorta, bruit in the aorta. and I do not hear any bruit. All right, and now I'm going to percuss the abdomen. All right, and there is general tympany throughout the entire abdomen. Now I'm going to lightly palpate the abdomen. I want you to tell me if you feel any tenderness while I'm doing this. And I do not feel any of the organs or abnormalities. Did you feel any tenderness?
No.
Good. And then the umbilicus is also good. Now I would check the femoral pulse and the inguinal lymph nodes, but we are not going to do that today. You can put your shit back down if you'd like. All right, I'm going to have you scoot up a little bit. We're going to go to the lower extremities. So the patient's legs have good muscle tone. The hair is evenly distributed throughout the legs. I don't see any edema. They are a little bit cold, but that makes sense because the house is cold. So now I'm going to check the pulses in your legs and your feet. So I'm going to have you bend your legs so they're a little wider than a 90-degree angle. All right, so this is me checking the popliteal pulse. And that is the 2+ on the other side. And that is a 2+ as well. Now I'm going to check the posterior tibialis pulse. And that is a 2+ and even on both sides. And now I'm going to check the pedal pulse. And that is a 2+ as well. And then I would check the toes capillary refill, and it is less than 3 seconds. All right, now we're gonna do some range of motion for the lower extremities. I'm gonna have you straighten out your legs again. And I'm gonna have you bring your knee up and then straighten your leg. Up, sorry. I'm gonna have you straighten your leg up. All right, and then we'll do the other one. All right, now I'm going to have you bring your leg above the other and then swing it out. Good, and I'll have you do the other one as well. You're good. And range of motion is good. So now we're going to go to upper extremities. So you can sit up again. And again, the skin is good. It is warm on the arms. I don't see any abnormalities. I'm gonna have you push my hands. I'm gonna have you pull my hands. We're just doing some range of motion of the upper extremities now. I'm gonna have you put your arms straight out in front of you and then put them behind your head. And then bring them up and around into the front. Oh, I'm sorry. And now I'm gonna have you put them behind your back and touch your sternum. Or not sternum, I'm sorry, your scapula, and then back and front. All right, good. Now I'm going to have you, oh, we forgot this with the neck. I'm gonna have you put your ear to your shoulder without moving your shoulder, and then do the other side as well. Good. I'm going to have you make a fist with your hand, and then extend your fingers. Good. And now I'm gonna check the radial pulse. And that is a 2+ as well. Now we are going to go to the neuro section of the exam. I will be testing reflexes. I do not have a hammer to use for the reflexes, so I will just be verbalizing and showing where the reflexes would be tested. I'll have you come on this side. This is the bicep, 2+. This is the brachial, 2+. This is the wrist, 2+. And then I do it on this side as well. Bicep, 2+. Brachial, 2+. Wrist, 2+. The patellar, 2 plus. Other patellar. 2 plus. The Achilles. 2 plus. The Achilles. 2 plus. And then the Babinski test, which I would use the end of the hammer for. Now we are going to do a smell test. So I'm going to have you close your eyes and plug one of your nostrils, and I'm going to have you identify what this smells like.
Coffee.
Good. And I'm going to have you plug the other nostril, and I'll have you do the same thing.
Pickle juice.
Yes. Now we're going to do a taste test. I'm going to have you stick out your tongue, and I'm going to put this on your tongue, and I want you to identify what it is.
Chocolate.
Yes. Good. So keeping your eyes closed, I am going to touch your face with a cotton ball along with some other parts of your body, and I'm going to have you tell me when you feel it.
Yep. Yep. Yeah. Mm-hmm.
Good. All right. Now I'm going to do a test where you tell me if it's dull or sharp.
Dull.
Sorry.
Sharp. Dull. Sharp. Sharp. Dull.
Good. I'm going to have you hold out one of your hands for me, and I want you to identify what I put in your hand.
Key.
Good. And then the other one?
Coin.
Yes. Good. All right, and you can open your eyes back up. All right, I'm going to have you stand, and I'm going to have you walk to the edge of the carpet and back. The patient's gait is even and smooth. And now I'm going to have you stand with your eyes closed and your arms at your side. And this is a Romberg's test to see if you can stand without using your hands or your vision. And you can, so it is a negative Romberg's test. Thank you.